Welcome to another episode. It's Wellness Wednesday with Britt. I'm Britt, and this week we are talking about making the most out of your time with your doctors and other medical professionals. This week we are very fortunate to have a doctor to speak with us about this relationship between patient and doctor. I think anybody who's been ill, chronic or otherwise, knows how frustrating and overwhelming it can be at times to try to communicate, to try to ask for what we need. So we're very fortunate to have our special guest who's going to speak with us about this topic. So let's go ahead and get into that. So today we have Dr. Hannans, who is a gastroenterology nurse practitioner, and she has been very kind to speak with us today on the topic of how you can make the most out of the patient health provider relationship. So Dr. Hannans, thank you so much for taking a moment. How are you doing today?
Great. I'm doing great. Thank you for inviting me.
Of course, happy to have you. This is really important to be able to speak with a medical professional directly, with this on this topic. So many people in the chronic illness community, or just anybody that has any reason to visit a doctor, they can feel very overwhelmed. I'm sure you face that often when you're seeing your patients. So this is quite a special treat to be able to speak with you today. So I'm very happy that you had time for us today, because I know you're a very busy woman.
I'm definitely glad to be here. Thank you for inviting me.
Of course. So to get right into it, I went directly to some of the chronic illness private Facebook community groups, and I let them know that I was going to be interviewing you. And we had several questions that came up regularly. And so I'm just going to go ahead and get right into those questions.
Okay.
So the first question we had was, how can we prepare for an appointment in order to get the most out of it?
Oh, that is an awesome question. So I kind of on the back end, I feel the same way. How can I prepare for my patients, from the first time that they come up until, all the subsequent visits? How can I prepare for them so they can get the most out of it? Because we got a little bit of time to go over a lot of things. So I think the biggest thing is to, depending on the amount of time it's been that I'm seeing you, make sure that you keep up to date and have it with you, either your medications or a list of your medications. Okay, and keep them up to date. Like look at them the day before the appointment. And what that helps me do is sometimes, there's medications get added on, taken away at the drop of a dime. So if I miss a medication, or somehow you're not taking a medication, and say your hypertension is not controlled, and I find out, hey, you don't have the medication that I sent there for you 3 months ago when I saw you the last time. But I don't know what medications you have at home. I just know what I send in. Whether or not it's a problem with the pharmacy, this happens all the time. I call the pharmacy, I say, hey, I sent this medicine and they don't have it, or, were they able to pick it up? And the pharmacist say, oh, well, we didn't have that medicine in. I'm like, well, did somebody want to tell me or let the patient know you don't have the medicine yet? So the biggest thing is that's my number one thing, is to keep a current list of your medication, or bring your medications with you to the office. And then the second thing would be to keep up with your, basically whatever goals we come up with at that previous meeting or previous office meeting. Try to keep up with where you are, or maybe what happened as to why you stopped the medicine back when I saw you 3 months ago. Keep up with the why, because that kind of helps me figure out, all right, is this medication just not good for them? Were they not taking it at the right time? So yeah, just kind of keep up to date with the medication, and then whatever the plan was, stay in route with whatever the plan was since the last time I've seen you.
Okay, those are really good points. In fact, those are such good points. I'm going to have to apply them to myself.
It helps. It helps.
Okay. So our next question that we had was, what is the best way that you recommend patients empower themselves by advocating for themselves? What is the best way patients can advocate for their own health?
So for me, I try to make it so easy for you to open up. So I'm looking at your body language. I'm looking at, whether or not you want to answer a question or you're hesitating. And I say, listen, if you just tell me what's on your mind, right, we can work through the rest of it, because ultimately it's your body, is your chronic illness. I'm trying to manage it, but I can't manage it if you're thinking about something else. Or, for instance, I just saw a patient yesterday and I wanted to order her for a procedure, and she was looking around. She was like, I guess we can order it. And I said, well, just tell me, what's better for you. If June is busy for you because you have other engagements, then we can push it out. But I won't know what is going on if you don't express to me, right? And now I know that's a tricky one because not all providers are the same, right? But my goal is less of the different, I guess we can call it managed care, the different requirements we have to meet for managed care, and more of you feeling empowered as you walk out my door. So if you say, listen, I've got this going on, I'm really not worried about this. Now I'm probably going to say, okay, well, you know what the consequences is behind that, right? But at the end of the day, there's no how can I say it? There's no love lost because of the decision that you chose. I just choose to empower you with all the information, the good and the bad, with the decision that you are choosing. So that's really the biggest thing, is to kind of open up and just let us in and tell us what's going on, or tell us why you weren't able to do something, or tell us why you want to try something else. Because oftentimes people come to me and they say, well, hey, I want to try this medicine. And so my question is, why do you want to try that medicine? So I can make sure the reason you want to try that medicine is a reason that you need to take it. And then I'll back up and tell you, all right, this medicine can cause this, this, and this. And of course, I put it in my chart so that if you forget and we can talk about it at the next visit. That's really the biggest thing, is just to open up.
Right, I can see that, because communication goes a long way. You can't read their minds and we can't read your mind. So
Right.
We've got to have that open communication. That makes sense.
Right, yeah.
So the last and final question that we got the most was, what is the most effective way to present our symptoms or ideas that we have about conditions that we may think we might have, or just ideas on what's going on with us, without being perceived as a hypochondriac or somebody that is just trying to come up with things to complain about?
Do you think that you're talking by way of, hey, I think I have a sinus infection, can you check me for that? Or are you saying, hey, listen, I've got this drainage, or I've got this headache, could it be related to a sinus infection?
I'm thinking maybe along the lines of, if, for instance, in the chronic illness community, we often go for years without getting a formal diagnosis. So a lot of times we're going to be doing a lot of research or speaking with people who have similar symptoms. And sometimes I know with some of the people that I've spoken to, and in my own personal experience, sometimes if you come to a doctor and you say, could I be tested for this particular disease, or do you think maybe it could be XYZ? Sometimes it's received well, and the doctor is like, yeah, why not? And sometimes it's not perceived so well. It sometimes kind of feel like you are, I don't want to use the term being gaslit, but kind of like, it's all in your head. So there's a lot of fear about being perceived, and sometimes that's coming from us. A lot of the times that's coming from us, but there's a lot of fear and hesitation about being perceived that we're just making it up.
Okay. I think I understand where you're coming from now. And that is, that's one of the things that you'll meet different providers that address things differently. I think because I am within 4 or 5 years of being in practice, um, my method is a little bit different than somebody who is a little more seasoned. Because I think most of the time, whenever you run into providers deeming you a hypochondriac or something similar, they are oftentimes more seasoned. Okay. And I guess how can we overcome that? I really don't know the answer to that. I will say though, whenever it comes to a medical provider, it has to be a good fit for both, right? So I feel like if you are at a point where it's 6 visits into this, give it at least 6 months, okay, to gain some traction. So if it's been 6 months, we're 6 months into it and we still don't have an answer, and now I feel like I'm not being heard, then all right, it's time to kind of look and see what else you have out there by way of providers. And it's okay. Some people may take it, may take it not really appreciate it, but it's okay if you don't feel like you're getting the care where you are and you've given it enough time. Like I said, 6 months is enough time to at least say, all right, I've got some kind of numbers. So let's throw out there diabetes. Hey, I'm a diabetic. My numbers came down from a 9 or came down from a 14 to an 11. There's some kind of movement in that 6 month time frame. If you don't have that and it's been 6 months and now you feel like you're not being heard, at that point you need to look at other providers. But also, on the flip side of that, for a provider, okay, it is all about the presentation, because I've had some people kind of address me like, hey, I've got this, what can I take for it? Or I've got this and I've already started taking this at home, or I got this from Walmart, or I got this from the herbal medication store. And it makes it hard because some of the information is kind of like I have to go in there and get it out of you, right? And if I'm not able to get that information, then I'm not able to make that diagnosis. So I would say, how can you prevent that from happening? You really can't, but you can give them all the tools that they need to figure out what's going on. And maybe that might help you out a little bit. But if that's six months, you hadn't made any traction, I would definitely look into seeing someone else.
That makes total sense. And again, that comes down to the communication issue,
Yeah.
I love that you said that not everybody is going to be a fit. And whether you're seeing a medical doctor or you're seeing a therapist, or it really does come down to you being able to be a fit with each other. And I really appreciate you bringing that out. One question that I do have for myself, you mentioned it about, taking herbal remedies and things from Walmart or over the counter. How do you feel about like alternative therapies in terms of, say, somebody sees their Chinese herbalist and they're prescribed something from, an herbalist over here? Would you just say that the most important thing is when they come and see you, anything that they're taking, make sure that that's on the medication list that they come into the appointment with?
Correct. So anything that you're taking, whether it's over the counter or it's from an herbal store or it's from a prescription from another provider, I highly recommend that you tell whomever you're seeing. And the reason that is because some of these herbal medications, I am an advocate for some herbal medications, okay? And now I'm not a practitioner, so I still have to do a lot of looking up of some. I know the major ones, but some of the other ones that kind of are not widely used, I don't know the benefits for them. But usually what I tell my patients is, hey, if you tell me you're taking that, we can at least put it on your chart. And what I look for is your liver enzymes to be affected. So if you start a new herbal medication, 2 months later, your liver enzymes are coming up, and that's the only thing that's changed, all right, we need to back off that herbal medication. That's really the biggest consequences with some of these herbal medications is that, the liver enzymes are affected. But now with that being said, it's not a common thing. Okay. And then the medication interactions too. So you just kind of want to make sure that everything, and the pharmacists, believe it or not, they have that duty to tell you if your medication is interacting with any of the herbal medications that you're taking.
Oh, wow. I didn't know that. That's really good to know.
So whenever you go pick up your medicine, do you sign the paper?
Uh-huh.
So that's you automatically signing that you do not want the education behind that medicine. So what you can do is say, hey, can I'm taking this herbal medication? Is anything that I'm taking interacting with it?
Okay, that's an excellent tip, because I had no idea that that's what I was signing.
That's what you're signing for.
Wow. Okay. Well, I definitely have some looking back over my own practices when it comes to, number one, how prepared I am when I go see my doctors, and number two, when I go pick up my medications. I now have two very important things to fact check, and I really appreciate you bringing those facts out, because I thought I was pretty hip to, what was important. And, I've been doing this ever since I came into this world, pretty much. So, I am sure there's a lot of people that are not aware of, number one, how important it is to tell your doctor everything that you are taking. I think we have a tendency to only think about those things that are prescribed. So, write down vitamins, herbs, all of that, so that you can get the full picture of what your patients are putting into their body, basically. Making sure that you communicate with your doctor, don't be afraid to communicate with your doctor, because you won't know what's in our head unless we do, right?
Right.
So, and making sure we are keeping up with our pharmacists, because they're kind of like that middleman between you and the patient when it comes to what you're prescribing, as far as, monitoring their health care. They are the middleman. So if there's a breakdown with the pharmacy, then there's going to kind of be a wall between you and your patients.
Right. Yeah.
So thank you so much, Dr. Hannans. I really appreciate you taking the time to speak with me today. You've given me a lot of food for thought, and I'm sure you'll give my viewers a lot of food for thought as well. You have a wonderful personality. You're very warm and very approachable, and I think that is so important when it comes to dealing with a medical professional, somebody that you feel like you can talk to. I feel like I want to talk to you,
Right.
you invite that, that you have that quality that's very inviting. So I think you're going to do fantastic with your lifelong profession as a doctor. If I ever move to Virginia, I will be the first one knocking on this door.
Look me up.
Dr. Hannans, thank you so much. That's all the time that we have for today. I will definitely be checking with you again, because I know that we'll have more questions. So you're not getting rid of me anytime soon.
That's all right. Just pass them on and ask me the questions, and I will answer them to the best of my ability.
Well, thank you so much, and you have a great day.
All right, y'all have a great day.